to the Drawing the Ideal Self podcast for July 2021. So I've now been doing this podcast properly for a year. The first couple were things I wrote as a blog post and then read out. And I decided, because when my husband read it, he said, that doesn't really sound like you. So I decided to have a go at doing it as a proper podcast. Anyway, I've been doing it a year now and can't really believe it's gone that quickly. So if you're new to the podcast, there's some other episodes you can listen to. If you've been listening all of that time, thank you very much. I really appreciate it. And what I particularly am grateful for is when people tell me that they found it helpful, because it was a bit of a gamble and I wasn't sure if it was a good idea or not. But enough people have come to me and said, thank you very much. We find it useful, so I'm going to carry on. Okay, so today's podcast episode has got some stuff in the show notes, a couple of references, but also in the show notes is some information about things that are on in PCP in the coming year. And you may want to have a look at those, particularly if you work with children or young people, or you're interested in how to use PCP for your own self-care. Those things are coming up through the Coventry Constructivist Centre, which I'm a part of. And there's also some information about an international constructivist meetups, which have been running for the last year. And I've put the links so that you can listen to the talks that have been videoed. Well worth getting on the mailing list for that, because you can have a look at the programme and decide which ones suit you. If you can't get to them, you can always listen to the talk part. All right, let's get on with today's show. So today is an interview that I did with Cathy Sparks, and Cathy is a speech and language therapist who is very experienced and trained in PCP. Cathy's going to talk about what it's like in her work, which is focused on people with brain injury. Okay, so Cathy, could you tell us a bit about your professional life?
Okay, so thinking back to originally where I came from, as it were, professionally, I originally wanted to work as a nurse. And then okay. I did slightly better in my exams than I thought I was going to do. And so I was reading a book that was what to do after your A-levels. And in there, in a tiny paragraph, I'm not even sure how I saw it, was a paragraph about being a speech and language therapist. And I happened upon that, and it said you had to be good at languages and music, and didn't actually mention the science bit, which was quite a large proportion of the degree. But anyway, and I thought, I've done a bit better in my A-levels. I might give that a go. And my mum knew a speech therapy assistant, and I had a morning with her. And on the back of that, I then went and applied and was successful, and I got in to do speech and language therapy, although it was called speech therapy then.
Where was that?
So
where did you do it?
I did it at a place called the Central School of Speech and Drama, which is basically an acting college, which does a kind of variety of courses, I guess. It's now moved to be part of City University.
Right.
So so it was quite an alternative place.
Yeah.
And it was a lot of fun. It was a lot of fun. So that's where I started, and I qualified as a speech and language therapist, and then I went into adult neurology and everything that brings with it. So I guess the reason for going into that was because I'd had a really fantastic placement, which I think is often the case, isn't it, just when you've been a student with somebody that's been really great. Yes. And the placement was just fitted a lot of what I wanted to do around working with adults who had strokes and head injuries. And so I applied for my first job, which was at Barnet General, and I got that. Okay. And then I moved around North London working as a speech therapist in various hospitals. Yeah. And then I got a manager's job working in a rehab unit in Southwest London. And I was there for about 9 years. Yeah.
Okay.
And it was during that time that I did my diploma in PCP. I guess we'll come back to that.
Yeah.
And as a result of that, then I switched to counselling. So I provided counselling, but to the same client group. So I've been a speech therapist, in the same area, and then I moved to being, well, a psychotherapist, but tend to call myself a counsellor in neurology, neurorehabilitation. So, and I've now spent nearly as long being a counsellor as I have being a speech and language therapist, which is very weird.
Yeah, that's interesting, isn't it? And what was the draw of PCP? How did you get into that, and why?
Well, I remember in my second job, actually, I was asking my manager for some supervision, and she was kind of implying that if I had the need for supervision, then clearly I didn't know what I was doing.
Things have changed, haven't they?
I know. And at the same time, I don't know, I think there was a sort of serendipity moment where I was reading in the Speech Therapy Bulletin magazine a tiny little advert, which was for a PCP foundation course with Peggy Dalton, based not far from at a house, actually not far from where I was living. And I thought, I don't know really what made me go for it. I didn't really know anything about PCP other than we'd had a couple of lectures at college around stammering. So I went on that, and that kind of coincided with this supervision kind of conundrum that that I was being told that supervision wasn't something that I would be offered. And so going to the PCP foundation course, I guess, gave me a sense of my worth and that I needed to value myself. And if I valued myself, I could probably be of better service. In fact, I definitely could be a better service to my clients or patients. And I guess that it was for counselling purposes, but it was also something about my own sort of self-care. And so that was my tiny little, it was like just a moment in time, but it's just been hugely impactful, I suppose.
I had a similar kind of experience. In the back of a book must have been Inquiring Man, and it said, contact Faye Franceller at this address, Warwick Way or whatever it was, which is now, no longer there. But it was just, I know why I did it, because I'd become interested in it at that point. But to find out you could actually do a course was fantastic. It was definitely such a joy. Okay, so go on.
No, I was just going to say, I think that there was something about sitting in the same room as people who were like-minded, not least of all Peggy Dalton, who obviously was a major guru in this field. But I think there was something about the feel of the group that made me think, these people I've got something in common with these people, even though I've only just met them, and they're all from very different backgrounds. And I suppose it just made me feel like, this is something that I can connect with and makes sense to me.
Okay, so you're in then.
I was in. I was in.
So I mean, you've done an interesting thing by going from the speech and language to the counselling for the same group. And any PCP, I think it's quite hard to do, if you like, counselling with PCP, because it so quickly gets to people's core, doesn't it? That you find out what really is bothering them and why. Relatively easily. So even though I've got PCP counselling qualification, because at the time I couldn't do enough hours to do the psychotherapy, I don't think I do counselling really, although it's handy to call it that because people get that easily.
That's true. I think there's something for me about, I was really becoming much more interested in the person rather than their specific communication difficulties. So I think probably the first 8 or 9 years of working as a speech therapist, I was very much tuned into the detail of their communication impairments and disabilities, I guess. And and that's because I worked very much in hospitals, and I think that was a kind of I don't know, that was a kind of key thread, I suppose.
Yeah.
And then it was when I moved into more rehab that I thought, actually, I'm becoming much more interested in who this person is, who is experiencing the communication difficulties, and less wanting to work on the detail of their communication breakdown.
Yeah.
So I wanted to be able to refer people to a counsellor who could support that person's communication difficulties, but there wasn't anybody.
Okay.
So then I've become that person, I guess.
Yeah. Yes.
So,
and so needed as well. Now when you think about it, it's crazy that people wouldn't think that would be an issue.
Yeah, it's easier to go to a therapist, we call it talking therapies, but if somebody can't actually talk, or they have difficulty understanding, or difficulties cognitively conceptualizing their grief, or the way they want to rethink their own identity, then of course there are going to be barriers in the interaction. And that's not to say that a lot of counsellors who aren't speech and language therapists or don't have that training can't offer that. They can. So I'm not saying that I've got special powers or anything, but I think it's definitely advantaged me in being able to offer that sort of space where people know that I come from a background of understanding what their communication difficulties might be about. They don't have to necessarily explain what aphasia is, or what cognitive difficulties or executive difficulties are, because I understand generally what they are.
I would imagine that's quite a relief for people when they're seeking some help, because most people won't come from that background at all, will they?
I think it is, because I think what happens is, although I go in as a counsellor, I think my role can become many other things. So it can become an educator, and it can become a navigator, and it can, I can help them to see where a speech and language therapist's role might begin and end, or where an occupational therapist or psychologist, I might say, oh, that's definitely something that you need to see the psychologist about, and that's not so much my role. So I think it helps in lots of different ways, and people are they are relieved. They kind of feel a bit more settled that I know what I'm doing.
And I wonder, have you got any idea how many dual qualified speech and language therapists there are? PCP and
I don't
speech and language.
I don't really know. I mean, I know some people who have moved from speech and language therapy into counselling or psychotherapy, but I don't necessarily know that many. Less than a handful, I guess, or who've moved from a therapy profession to counselling. I don't really know that many who are working in brain injury, and certainly not who are working using PCP. So I guess I've become the niche. It's very but I also don't want to say, oh, then I'm the only person that can offer this. I think there's lots of counsellors out there who can offer, and people feel comfortable. It's just that that's what I happen to bring to the mix.
And very helpfully, because if other people are thinking they will offer that to a client, then what have they got to take into account? I'm thinking that people who have a head injury or some kind of neurological damage, the risk to their sense of self is enormous, isn't it? And it would be easy to be caught up in all the medical side and test and retest for different things, and you're getting better at that and worse at that. It may make no difference to them that they're getting a bit better, because of how they feel.
I guess from my speech and language therapy background, we were obviously therapists who were assessing with tests, that were numerical or had a sort of checklist and what have you. But I was a very big fan of goal negotiation and working out actually what the person was interested in and what made sense for them, and how we could set not necessarily a very defined goal, but at least a goal kind of area which had meaning for them. So I suppose I've not necessarily worked so much using goals in that with that terminology as a counsellor, but there's a thread of what is it that people are trying to work towards, or what is it that people are trying to cope with, and very much referencing their starting point rather than a test which is about some norms and how they relate to that. So I think that PCP has offered me that perspective and the confidence, I think, to start with where the person is rather than where the test is. Tests are really useful, but they don't have much meaning, I think, for the person that's in front of you.
Yes, and that's trouble, isn't it? That they're based on a norm, and you might be talking to someone who's way outside the average, or doesn't see themselves like that. And it doesn't matter how many times you tell them, well, that isn't too much of a problem with that. If it is to them, it is.
That's right. And they might have something they want to work on or work towards, which is massively different from where you think. So I think, again, that suspending your own construction of what you think they might be wanting. Somebody you might think, they're probably going to want to go back to work, or they're probably going to want to look at their relationship with their partner or whatever. But no, they want to work on, they maybe decide that they want to take a different angle and want to work on, I don't know, setting up a new business or having a different hobby, or maybe their communication is an issue, but they want to work on their physical, and I think that's another, what's most important for people. And I guess that's a big part of good listening, I suppose.
Good listening, and then I suppose a level, I think, of belief that is so important that you cannot then ignore it. Because sometimes people could do the listening and they can hear and they can write in the notes, this person wants to work on this. Well, I'm going to do that. Or because this fits with what our service offers, we can only do that.
Yes. And I think that's another PCP thing for me, is about seeing that there are always alternatives. So if somebody comes with something that I think is an alternative and not the thing that I might imagine, I don't tend to pre-think too much, because otherwise I can hold on to my view. But that's just a big part of it. There's always an alternative way. There's always an alternative that they might come with that they want to look at, and then there's always an alternative way of approaching it, which we'll find together.
And what, if, in terms of your work with people with all those kinds of difficulties cognitively, what sort of things do you see people come to you about? Are there any repeating themes to do with having a head injury or some kind of neurological damage? Sometimes I guess it can be damage that it's quite hard for people to see, to know about.
So one of the things is their expectations of themselves. I think that's a theme that recurs, is that they come thinking that I or any professional will be able to make them who they were before. So I suppose that's, notwithstanding what their communication or cognition is like. I mean, I would be the same. I would want to, find a way of finding myself, and finding those skills again. So I think that managing people's expectations of what therapy can offer and what potential they have. And I wouldn't say that I say to people that they haven't got potential. I think everybody has. I genuinely believe everybody's got potential, but it's how that is expressed. So it's not necessarily that they're going to have the potential to go back to who they were before or achieve their ideal self, I suppose, in that way. So I think that that's a big one. And I suppose that's sort of coupled with quite a lot of general self-awareness and insight issues. But that's always a tricky one, because sometimes it's the sort of protective denial that they're just denying. And sometimes it's actually that they've specifically got an insight problem. So, and that's always hard to work out. And it's quite often a bit of both. So I suppose to start with, it's developing people's awareness of themselves, who they are, who they could be, what the possibilities are, managing their expectations of the role of therapy and intervention in that, and the role of other activities or other relationships like friends, family, other social relationships, work, hobbies, plans, saying I'm one part of a bigger picture. I think that's another kind of part of it. And I suppose for people who have changed quite dramatically, whether it's with their communication or their cognition, I suppose it's a case of trying to help them to see that there is a richness in communicating or being different from how they were before, and about working with families or friends to kind of support that difference, that it's acceptable and okay.
I'm wondering about people who have a very sudden injury to their brain, say they get knocked down or something like that. That must be very different from people who know they've got declining function, I guess.
Oh, definitely. Yeah, it is different. It's difficult to kind of generalize, but I would say most people I see have been fine one day and not fine the next. There's been a definite moment in time. They may have had no clue. I mean, occasionally people have had like a small TIA or a little mini stroke, and then they end up having a big stroke. Some people know that they're maybe young, perhaps 18 to 30-year-olds. Maybe they have had a few accidents because they're quite high risk takers. So they may have had something which they've come off a bike or motorbike, or they've done some extreme sport and they've got injured. And then this time they've injured their head. So they may have had a sense of what the sort of person that they are, and they are taking a risk, or they may have had a condition like a previous high blood pressure or something. But essentially, nobody's really prepared for it. Nobody's prepared for that. One day you're not okay, and the next day you're not. You're just hopeful that isn't going to happen. Whatever you do, you might have changed your diet, you might have lost weight, you might have stopped smoking, but you still might have a stroke. It's just, you just do your best, and you might wear a crash helmet if you're doing some extreme sport, but you still might land on your head, and it still might cause damage. So I would say that most of my caseload is those people who've had a sudden and lasting change to their physical or cognitive or communication abilities, and their sense of identity and their sense of self. And with that comes a whole range of difficulties in relation to work, in relation to if they're of working age, which they often are, or in relation to their family and friends, and their sort of losses that they experience, their loss of future. It's sort of like, what have you lost from the past? But actually, a lot of it is around their loss of what they were anticipating they might have. So if somebody's in their 50s, let's say, and they have a stroke, they were perhaps thinking they might retire at 60, and they would then have their life. They would have their traveling around the world, or I don't know, buying a house in France or whatever they wanted to do. And they have lost that future. So it's really massive for people.
And it must be so difficult for the people they live with as well. Would you ever see the young people involved, let's say their brother or sister or their child, because they've got even less experience of life? I think it must be very tough for them to understand that change.
I would start with the person who's been referred. I'd start with the person with the injury or the stroke or whatever, and then I would have a conversation, maybe on that first time, if it's appropriate, with a family member, if that person wants, very much guided by what they're wanting. I have had situations where I had a lady who had a progressive neurological difficulty, and she was just at the stage where really starting to sort of have a bit of insight, but not enough to really understand what her difficulties were. And so I said, did she want me to see her? She was referred. And she was like, I don't think I've got any problems. I think I'm okay, really. But you kind of knew that she probably did have, she sort of knew, but didn't know. But her husband said, well, if she's not going to have therapy, then would you see me? And I said, that's okay. If your wife has decided not to have me see her, then I can see you, but I can't then see her again. I kind of try and make it. So sometimes I might see people together. Got a couple at the moment that I see together. And then I sometimes see the guy who's the one who's he's got a brain tumor, actually. I see him on his own. And then sometimes I see the children, but I very much, it's always with the person in mind. So I wouldn't say, oh yeah, I'll definitely see, oh yeah, anybody can see me. I'll always ask permission. And if it's not appropriate for me to see them, then I would find someone else, because it's easier to find someone else with the family because they haven't got a communication difficulty. So I try to sort of really focus on the person with the communication or cognitive impairments.
And I think it's only relatively recently that people have understood the needs of the wider family, haven't they? That, you know, when I was young, I don't think people even thought about that. You know, practice was crazy in comparison to now. All the things that we understand about, you know, the impact of being a carer all of a sudden, or of having a parent with a disability all of a sudden, you know, all of that stuff was unknown before, wasn't it?
Yeah, I would say that we would always, when I was working as a speech therapist, we would always have given the option for the family to have sessions. We'd had some group sessions with different families together, because I think that can be also very helpful. Some families didn't want, they said, no, spend all the time with my partner or with my dad. They didn't want to get involved. But there's a lot of work around conversation partners and understanding that obviously it's not just about the person with the difficulty, it's about whoever's in their circle and how to help them to communicate and support their difficulties. So I think it's something that I've always thought was important, but it's definitely changed in terms of the global kind of attention that's been paid to it. And the value of that work.
Absolutely. Definitely. I mean, the fact there is a role of a carer now, you know, that it was ignored before, wasn't it? Just, you know, that's just somebody's mum or partner, or, you know, it wasn't clear.
And that
what
word
they were doing.
carer as well, the word carer, which is just so loaded, when I know that some people sort of say, well, my wife, if she's becoming my carer, I'm not sure she's my wife now. And having that type of conversation, she's become so much of a carer that we've lost our, you know, relationship around husband and wife, or partners, or whatever.
Very difficult. And would you know, somebody was using a PCP approach, working with people in those situations, what would you say are the key things they need to take note of?
Right. So I guess some of the stuff that we've referred to already, for example, always starting with, I've just got a big thing about always starting with the client. Never mind how much information you might have been told from other professionals, giving that opportunity for them to talk about their story and their perspective and their construction of what's happened, I think is that would be my sort of starting point. I think giving people choice around how to work. So that could be from the practicality of how often and where and all those kind of things, but also what area is most relevant and most important. Again, suspending my own stuff, I guess. I might think, it's better to work in this way. So I think really focusing in on what's most meaningful for that person, developing the relationship around the two experts in the room. I think that's not saying, I do quite a lot of work saying, I don't have the answers for you. I'm here as a collaborator. I'm here as a, you know, I'm here in the sort of alongside you. I think that's for me, that's a very PCP thing, to be kind of bigging them up in terms of their knowledge of themselves, which of course I don't have any knowledge of them until they land in the room.
Yes,
maybe a bit about their medical side, but not really about who they are as a person. I think I've got an ultimate sort of positivity through using PCP. I would always, not saying that people can achieve things that they can't achieve, but when people are saying or intimating that there's no way out, I think I'm always saying we can make this work. We can make something happen here. And invariably we can, even if it's just helping them to see things a bit differently. So it may be that they can't do some things that they want to do, but maybe they can see and view the world differently through working with them. And again, I think that's sort of the idea of the different lens through which they might see the world. I think can be different. I don't know whether those are...
that's really helpful. And what, if you met somebody who was going into this area of work, what sort of challenges do you think they're likely to face? I've never done any more than a very cursory glance at that work, but I can think, I think it'd be pretty difficult, and there are going to be all kinds of issues that are going to affect me. So what sort of things, would you say to, let's say if it's somebody in your situation, speech and language therapist who wants to get into the kind of therapy work that you're doing, what do they need to watch out for?
I think being very prepared, I would say, immediately you're asking that, I was thinking I always need to have my sort of basket of tools, I guess. So it's not equipment, but so it could be physical items or it could be conceptual items. I suppose it's sort of like any therapist, like your tools and techniques, but it might be some physical things. So I think it could be quite daunting for someone to open up a dialogue. Maybe they are a speech therapist and they want to open up a little bit more of a dialogue with somebody that's to do with their more emotional side. What I would say is that even if they weren't wanting to become a psychotherapist or a counsellor, just opening up a little bit more, I think they would feel more confident if they had some frameworks, some tools, some techniques. And I would say most of my time, a blank sheet of paper is really helpful, and some pens, and a basket or box of buttons or shells or something that gives a sort of like a triangulation, so that it's not just you and them and they can't really speak very well or they can't really communicate very well. I would say get some things on the table, which could be the blank sheet of paper to do some drawing or writing, or just to keep an account of what they're saying. If they're saying the odd word, write the word down. Really trying to keep that level relationship as much as you can, in terms of that what they're saying is valuable, or or using some buttons or stones or picture cards. I would have those physical items in my basket or in my bag with me in case. Notwithstanding that I might use something in their environment if I'm in there. Don't be nervous. I would probably say that don't be nervous to reach for some things in the client's environment. They might be sitting in their living room and they might have some photos on the side. I might use the photos as a way of not just like, who are these people, but a way of helping them to express something about how they're feeling. So or they might have some postcards stuck on their fridge, or they might have I'd be like, why don't we have a look at this? And I had one lady who had her own jewelry business, and she basically dismissed my my offer of my tools and said she wanted to use her jewelry. And so we used her jewelry. So I think there's having the confidence to actually have some items that would support the communication around the more psychological conversation, I would say would be helpful. And then I guess there's a load of PCP tools and techniques that I might use a dependency grid, might have that as a
Yeah.
conversation, just looking at who they were depending on, whether it was always their partner or, looking at how they could spread their dependence on others. So that's what I mean conceptually. I might have that as another.
Yeah, that's really useful.
And asking people just what 3 words might someone say about you, might your husband say about you, might your friend. Those in my toolkit, so that if somebody has very minimal language or is finding it difficult, offering them a little bit of scaffolding, I suppose, to enable the conversation. Otherwise you might think it's a bit silent if somebody can't speak. And offering them a pen, offering them those sort of choices, I suppose.
And what about, those, just thinking about the silence, the processing difficulties that some of these people must have. You speak and then they take a while to work out what you're trying to say, and then they've got to work out their answer. What's that like sitting with them? I'm thinking if somebody's new to this kind of discussion, that could be quite daunting, couldn't it? They might be tempted to rush on.
Well, I suppose that's where my speech and language therapy background comes in, because we would have used, or I would still use, what we might refer to as a total communication approach. So we would be saying something, we might be drawing it, we might be writing it, we might be pointing to it. So I would be maximizing that person's opportunity to understand what I'm saying. And also I would be monitoring the way that I was asking. So I wouldn't be giving lengthy sentences. Like, I'm speaking a lot here, but there's no way that I would speak like this if I was with a client who had minimal language output or some difficulties with input, their processing. I suppose I would just be starting to find out what helps. So that would be an initial session. What helped them to understand? What helped them to express? And I would be trying lots of different approaches: drawing, writing, speaking, a combination of 2 or 3 or more. Or I might ask the family member what they find successful. So I'm really looking to. It's not supposed to be a space where somebody feels like they're being tested. Oh, you seem to be having difficulty there. Shall I try some drawing? Let's try some drawing. Does that help? Maybe that doesn't help. If that doesn't help, I might, so I'm maybe trying to guess what they're saying, not guess as in just something random, but they look like they're trying to say something. I might say, are you trying to say this? Or are you trying to say that? So I wouldn't be sitting there waiting for them. Having said that, I might give them some space if I think that that's what they need. It's a delicate balance.
Yes. Do you sometimes have people who may be able to write but can't speak?
Yes. Yep. You can. And it may be by writing that actually helps their speech.
Right. Okay. And would you, if someone's like that, would you write to them? They might be sitting with you, but would you have an exchange of writing, or would you speak and they write?
Whatever's most helpful for them. There's not a right or wrong really there. If it's helpful, if they find it helpful that I maybe say and write and they also write, fine. If they find it more helpful for me to say and them to write and me to say out loud just to check, I'll do whatever feels most useful for them.
Okay. And what about supervision then? Because I'm very aware that if people are working in your kind of area, they might be acutely aware of their supervision needs, unlike your previous manager. Because you're dealing with people, and I suppose I always think that supervision is being aware of yourself and thinking about how it impacts on you, and not being afraid to notice that, not pretending to yourself that no, I'm fine with this. And you must meet people who are doing that kind of work who they hadn't realized that it was going to get to them and really upset them or make them annoyed or whatever it is.
So I suppose there's different people that I supervise. So I supervise quite a lot of therapists, so speech therapists, occupational therapists, physios, psychologists. I have supervised social worker. I've supervised people on their professional practice, maybe some clinical practice as well. That might include clinical practice also, but it might include a wider reach, I suppose. And I think that some of those people are very drawn to working more psychologically with clients. And I guess the ones who are more likely to be drawn to working in that way with people within the role that they have are often those who are more aware and less surprised about the impact, because they're probably already quite aware. So they may be surprised about some I'm not saying that they've got it all sussed or anything, but I guess they're ones who know that they're stepping into that realm, that they're using their counselling skills. The people, and then I do supervise some counsellors as well, but obviously that's a different sort of, but the people who maybe, as you're describing, are a bit shocked are people perhaps who are more likely to work in a way that is not taking so much account of the person's psychological needs, which is fine because that's how they've decided to work. But then what happens is that person's psychological needs can't be ignored, and they bring something, I don't know, the speech therapy space, which is more emotional, and that then does impact on my supervisee, and then they would bring it perhaps in a state of panic that they hadn't intended it to go in that direction, but the person had taken it in that direction. And I'm always a big validator of the fact that somebody's felt comfortable to open up, even if you weren't necessarily saying, let's talk about how you feel about this. The fact you've created a space that people feel comfortable and confident to say something difficult is massive. But obviously it's quite derailing for some therapists who don't want to work in that way necessarily. And so that's more of a challenge for the supervisee, and maybe sometimes more of a challenge for me to help them to feel like they haven't suddenly opened a can of worms, which is often the expression, I've opened this can of worms and I don't know what to do with it. But I think often people only bring things that they actually are comfortable bringing, and just sitting with it can be as helpful as doing anything about it. So it's helping the supervisee see that.
You offer supervision that's specialist for PCP as well, and there may be people listening to this who are PCP people, either in this kind of field or they're speech and language therapists thinking, I would love a PCP supervisor. So tell us about what you have on offer.
It's like I'm selling myself, Heather, here.
That's fine.
Well, first of all, I guess a large number of people who I see for supervision, I would be using my PCP approach, and they may or may not know it. So I do say at the beginning, this is my background and this is PCP and etc. And I might be, so I often am implicitly using it rather than explicitly saying about it. So I might say, this model might be helpful and this is from PCP. And my questioning will be of very much of a PCP style, but I'm not necessarily thrusting PCP into their practice, because I think that's their choice. If they like to be supervised by me, that could be because of the PCP-ness of me, or that could be for other reasons, my background, whatever. But there are some people who want the PCP bit of me. And so we would foreground, I guess, the PCP theory or the PCP approaches, but not to the exclusion of what they want to bring. It would always be centered, again, like with the patient, that's the starting point. The supervisee, that's the starting point, is what do they want to bring? And let's just have a regular supervisory relationship. But I might ask them, if, they might have done the foundation course, for example, and they may want me to kind of help them to highlight, or they may have come with something that's a bit PCP, and they might say, I think I did a bit of PCP there. or oh, would that technique be helpful? So I'm very aware that is my approach.
Yeah.
And with some people I've foreground it and some people not. But I also do run a supervision group, which is specifically for people who work as practitioners. We've got some speech therapists, I've got a psychologist, I've got a coach in there as well. So they work in their normal jobs, as it were, but they've done the foundation course and they're wanting to use the PCP more in their practice. So it's very foregrounded. That's what they've come for. They've come for the PCP-ness of supervision.
Yeah. So, and do you do that on Zoom, I think, do you, at the moment? You must do it at the moment.
Yeah. Well, actually, some people don't live near me anyway. So we were doing a kind of hybrid before, but now actually it works quite well because we're all on Zoom and we can still share things, the shared screen on Zoom, and that works really well. In fact, it may be that's what we carry on with because it's more of a level playing field. People like to come to my house, I think, and have a coffee, and
of course
the social aspect of it. But but I think it's nice that the people who don't live near here get the opportunity. It feels a bit more even. And I think
there could be somebody in Scotland who wants you because you're a PCP person and you're a speech and language therapist, and how could they access it easily except remotely like that?
Yes, and that's just helped. That's just been such an interesting bit of creativity around this year, isn't it? How to use Zoom and not feel like it was a second best, which with some situations I know some of my clients have felt we'll make do with this, but we really want to get back to having you in the same room. But I think the supervision group, it's everybody's more used to Zoom, so it's not my favourite, but it offers something that I think can be really helpful. So I have to like it.
I feel the same. But I would never choose to do it over being with somebody in a room. However, in these circumstances, it's better than not having it. And it can be a lot better than not having it. It's not just that it's the worst ever offer. It can work out to be fine, but still, all of us who work with people like being with people, don't we?
I know, you can't beat being in the same room as another human being.
No. And it, to me as well, and I'm guessing if you do some of your sessions on Zoom with your clients, there's something that you're not seeing. You're not seeing, that they're now started jiggling their knee because they're getting agitated by what you're saying, or they're feeling worried about it, or whatever. But you haven't got that clue to pick up that there's going to be something coming in a minute.
Yeah, I mean, the non-verbal communication side of things is absolutely critical in a lot of interactions with people because it's a larger percentage of their communication potentially than the verbal.
Yeah.
So I suppose for some people, we've had to not work across Zoom because it doesn't actually work for people.
Right.
So we've kind of had to mix and match what does work and what doesn't work. And having said that, it has been helpful. So I've been running a group for people with stroke and head injury and brain injury on Zoom, which has been going over a year now. It was a group of people who met anyway. We met face to face anyway. Then obviously COVID hit and we switched to Zoom. And I probably would have predicted that it wouldn't have worked so well on Zoom, but we carried on going for the whole year, every 2 weeks, and now every month.
Wow.
And
well done.
They've all learned how to use Zoom better. They've learned how to interact. So it's a support group for people with, a neurological difficulty and some sort of cognitive or communication problem. Yeah. And it's, again, starts with the group, whatever they want. So I don't go with an agenda other than we do have a quiz every time now because that's what they asked for.
Okay.
And we're starting getting some of the clients doing the quiz as well.
Yeah.
So, yeah.
Yeah, that's interesting. Have you written that up, Cathy?
No.
It would be good.
I think they should write it up, to be honest. They would write well. Yeah.
But somebody should, don't you think? Because I think people might think it's impossible to do. That's what I'm thinking, that you can't do that with that client group in using all the fiddly things to do with using Zoom, etc. It won't work.
We have had some
otherwise
learning points, shall we say?
But so is everybody.
And I think actually one of the things I was going to mention was that the group has worked amazingly well, and they're all very connected and they've enjoyed that. But I think also some people have found it better than face-to-face, purely from the perspective that they don't have to travel. And fatigue is often an issue for people, or can be an issue for people with brain injury, and that has been that problem has been taken away because they don't have to travel. So they might have managed it's a 2-hour group, they might have managed it, but by the end, or by the last half hour, they might have been struggling and then wiped out for the rest of the day. But now they can sleep till when they want, they can have the group, they don't have to leave their house, they don't have to get on either public transport for some people or a lift from others. So it solves that problem for them, like it would solve a problem if somebody wanted supervision in Scotland or far away. It solves some transport travel issues and the sort of consequences of that. So
and in lots of ways it's been a good year for PCP, because stuff has moved online and people in other countries have been able to attend, which is great, isn't it? And that's really different. People can get some training through you. How do you want people to contact you if they're interested in that?
Okay, so I have over the years run a lot of foundation courses, and more recently with Adele Pyle, we've run an introductory day, which then has, from some people who were on it, wanted then to turn into a foundation course. So a number of people from there, we've now created an online training course, or we are creating it as we go, I suppose. So I think if people want some online, either an introductory day, because people might not want to commit to 6 days, which is what we would do all together. So the introductory day would be one of those 6 days.
Right.
Then they can contact me at my email address, which is Cathy at cathysparks.co.uk. So I have a website.
If I put your website, people can find your email from the website, can't they?
Yeah. So
great.
That is an option.
And that's the good thing about that, is if you're doing it online, it doesn't matter where people live. So great. And there are people listening to this in other countries, apparently, according to my podcast app that tells me that. So you never know. Might have someone from somewhere else.
What's your reach? How far's your reach?
Australia.
Oh, my goodness.
America. Yeah, that's good.
Wow. That's your internationally renowned, Heather.
No, I think it's just that there aren't any others. But that'll do. I don't mind that. Eventually other people will do them, so that's good.
No.
Okay, that's really helpful.
Has that been all right?
Yeah, fantastic.
Well, that was a really interesting interview, and it's made me think a lot about what it might be like if I were in that situation as somebody who'd had that kind of brain injury. Cathy certainly has some ideas about how to work creatively with people who are struggling to communicate, and I think those will be useful, whatever client group you work with. Cathy also sent me a paper which was published in a book called Psychotherapy and Aphasia, and I will put a link to that as well in the show notes, because that was really interesting. Okay, so next month I'm not sure exactly what we're going to do. It may actually be another interview, if I can get that sorted out. Otherwise, I'll find an interesting paper, or at least a paper I find interesting, and I'll talk to you about that. So that's going to be August, and in between then and now, I hope you have a really good summer. Obviously, if you're in the UK, You might be depending on the weather. And so far it's been pretty good. Might not stay that way. That's how it is here. If you're in another part of the world, you might not be in summer. So you've got something to look forward to, where we're only going to have darker nights from now on, which is a bit grim. But there we go. We've got plenty of days left. Okay, look forward to seeing you next month. Bye.